The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk.
You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome back to Sky Women's Health Podcast. I'm Dr. Carolyn Moyers, your host, and I'm just so grateful for all of my members and patients who trust me and remind me that this podcast matters to you. Someone was in the office yesterday and asked me to please keep going. And you might have noticed that we did not have an episode last week because life just got busy and I did not have time to record. So here I am in between the mixed of the day of work life and mom life, and I am sitting down to record an episode just for you. Today, we are talking about hormone therapy after 60 because there are a lot of boomers, a lot of my patients' moms who are kind of upset that they missed this window after the WHI in the early 2000s. And I want to kind of walk through what that means and if women over 60 are a candidate, right? Because we hear about this window of opportunity frequently, and it's almost as if it's a hard stop that if you didn't start hormone in that time frame, you're absolutely not a candidate. So let me start this by saying that vaginal estrogen is safe for everybody. Every vagina loves estrogen, vaginal estrogen for life. Anyone can use that and start that because it is not significantly absorbed. So it is not going to do away with hot flushes and night sweat. It is really addressing your genitourinary symptoms that include vaginal dryness, painful penetrative sex, your urinary urgency, frequency, urinary tract infections. I say often that vaginal estrogen saves lives and it also saves relationships at times. And it doesn't matter if you're partnered or not, but if you're having vaginal dryness and painful wiping and just urinary urgency and frequency up and down to tinkle at night. None of this is fun and can be easily resolved with consistent use of vaginal estrogen, whether that's in a cream, a tablet, a suppository, a ring. There are so many options for delivery, even a vaginal DHEA, which is a nightly suppository. So getting that out of the way. So we're talking about something that causes a lot of confusion, fear, and frankly, missed opportunities for women to feel better. And that's hormone therapy after 60. So if you've ever been told you're too old for hormones, you missed your window, or at this point it's just not safe, this episode is for you. Because the truth is, it's a much more nuanced conversation, and women deserve to have those conversations. So I see this every single week in the office, women in their 60s or 70s, sometimes older, who are either miserable with hot flashes or having sleep disturbance, mood disturbance, joint pains, dealing with painful sex or recurrent UTIs, watching their bone density decline, feeling dismissed because of a number on their birthday cake, right? And many of them were never offered hormone therapy when it would have helped them the most, or they were taken off of it abruptly without a real discussion. So let's get into this conversation, the timing hypothesis and what it actually means. So you may have heard about the window of opportunity for hormone therapy, usually described as under the age of 60 or within 10 years of the final menstrual period. But here's the key. That guidance is about starting hormone therapy, not about continuing it, not about never using hormone therapy after 60. Age alone is not a contraindication, and this comes from the Women's Health Initiative, where they saw the most benefit in those who started hormone therapy prior to age 60 or within 10 years of menopause, and a decrease in coronary heart disease and all-cause mortality. The key is, though, that medicine has to be individualized. Age alone can't be that hard pass. What matters is your overall health, your cardiovascular risk, your personal history, the type, the dose, the route of hormones, and your goals. So remember that medicine should be individualized. And in the Women's Health Initiative, we only looked at one dose, one route, and one formulation. So this was one dose of conjugated equine estrogen that was given orally, and medroxyprogesterone acetate, which is a progestin, a synthetic progesterone that was given also orally. So it was one dose, one route, one formulation. One of the biggest fears around hormones after 60 is the risk of heart disease or stroke. And here's what we know. Oral estrogen has a different risk profile than transdermal estrogen, so that's given via the skin. So this could be your patch, your gel, your spray, or vaginal ring. Higher doses can carry different risks than lower doses, which are typically the physiologic doses that we're providing in hormone therapy. And starting hormones many years after menopause in someone with untreated cardiovascular disease is different than continuing therapy in a healthy woman. So, in my practice, we don't guess. We assess blood pressure, lipids, insulin resistance, inflammation, family history, lifestyle factors, and sometimes even getting a coronary calcium scan to assess cardiovascular health before we decide whether or not you are a good cardiovascular candidate, whether you have any significant risk factors. But even in the Women's Health Initiative, for those who initiated hormone therapy more than 10 years from menopause onset or age older than 60, in a 2015 Cochrane meta analysis, they found that there was no evidence that hormone therapy had an effect on coronary heart disease. They looked at these people on an average of 3.8 years. There was an increased risk in stroke and blood clots. So that is typically the concern. Then there was a 2020 systematic review and meta-analysis of that randomized controlled trial showing similar results to the 2015 Cochrane analysis for older women who initiated hormone therapy. And compared to the placebo group or non-users of hormone therapy, initiating hormone therapy in your 60s or older or 10 years after menopause had a null effect on coronary heart disease and all-cause mortality. So looking at the data even closer, this is when we initially have reviewed the data and given an analysis, and then we go back and we take a look at that in detail. And in that review, they found a null effect, so no effect on heart disease and all-cause mortality in individuals over 60 who started hormone therapy. The important thing also to consider is, when we're thinking about this risk of stroke or clot, that's specifically to the estrogen that was given orally in the Women's Health Initiative, which typically that is not how we are administering hormone therapy. For most patients, we're administering it transdermally, where we don't have a significant increased risk in clotting factors because we're bypassing the liver. When we take it by mouth, it goes through the stomach, gets absorbed, and processed through the liver. And also consider the indications for hormone therapy. So the indications for hormone therapy include vasomotor symptoms, so those hot flashes and night sweats, the prevention of osteoporosis, so that osteopenia, low bone density, and genitourinary syndrome of menopause. So in terms of whether or not you need to use hormone therapy, do you need to use systemic estrogen, or do you just need vaginal estrogen and progesterone to help with sleep, or do you need testosterone to help with sexual desire? There are a number of ways that your hormone therapy can be absolutely nuanced and tailored specifically to you that may completely minimize your risk. So let's talk about bone, brain, and quality of life that often gets overlooked. So bone loss accelerates in the menopause transition and continues quietly for years. Hormone therapy is the most effective treatment for preventing osteoporosis, especially when started earlier, but it can still play a role later depending on the patient. Now, the things I always like to remind people of are that we have to eat a calcium rich diet and make sure that we're taking some supplemental vitamin D and checking our vitamin D levels and doing our weight bearing exercises as part of our bone health. But hormone therapy also impacts the quality of our bones. Now, in regards to brain health, sleep, mood, cognition, these all matter. And untreated vasomotor symptoms are associated with poor sleep, increased cardiovascular strain, and decreased quality of life. So, when we're thinking about this from a longevity perspective, quality is oftentimes the goal. Like I said, vaginal estrogen, non negotiable. Let me be crystal clear vaginal estrogen is safe at any age, full stop. It does not increase risk of breast cancer. It does not increase risk of recurrence of breast cancer. It does not increase your stroke risk or heart attack risk. And it dramatically improves the vaginal dryness, pain with sex, recurrent urinary tract infections, and vaginal tissue health. If you are over 60 and suffering silently with this because someone told you it's too late, that is absolutely unacceptable. And one of the most unacceptable things is when I have patients who come in and this is their primary complaint and they've been put on a testosterone pellet and never given vaginal estrogen because they were noted to have low sexual desire. Well, we don't desire things that hurt. So we have to address the underlying biologic concern, and that is the atrophic tissue. And that's what exactly what vaginal estrogen does. So when I care for women over 60 who are considering or continuing hormone therapy, we reassess regularly. We use that lowest effective dose. We favor transdermal routes when appropriate. We address muscle, bone, metabolic health, and integrate lifestyle, strength training, and these osteopathic principles that are just at my core. It's not all about anti-aging. It's about pro-function, pro-strength, pro-living well. So, a quick summary of some of the things that we learned from the Women's Health Initiative is that hormone therapy remains the most effective treatment for vasomotor symptoms and genitourinary symptoms, and has been shown to prevent bone loss and fracture. Personalization and shared decision making are absolutely key. Looking at the benefit risk profile, risk stratification by age and time since menopause is recommended. But again, like we talked about, it's incredibly nuanced. The benefits of hormone therapy outweigh the risk for most healthy symptomatic women who are aged younger than 60 and within 10 years of menopause onset. The transdermal route of administration and lower dose of hormone therapy may decrease risk of having a blood clot or a stroke. Hormone therapy does not need to be routinely discontinued in women aged older than 60 or 65 and can be considered for continued use beyond 65 for persistent vasomotor symptoms, for quality of life issues, for prevention of osteoporosis, after appropriate evaluation and counseling of benefits and risk. And for GSM, vaginal estrogen is queen. She rules. And let's not forget the 2024 study that looked at nearly 10,000 women on Medicare who showed that those who were 65 and older who had continued hormone therapy versus those who never used or discontinued hormone therapy, and found that a decrease in all-cause mortality and breast cancer and colorectal cancer and cardiovascular disease and osteoporosis and dementia. So there definitely is benefit to continuing this as long as you continue to be a healthy candidate. So the take home message is that hormone therapy after 60 is not one size fits all, but it's also not an automatic no. Women deserve thoughtful conversations, evidence based care, and providers who understand menopause beyond outdated fear. And most of all, you just deserve to feel heard. If you've been told that you're too old to feel better, please hear me. You are not. If you want help navigating hormone therapy, bone health, sexual health, menopause transition at any stage of life, my team and I are here for you at Sky Women's Health. We see patients across the state of Texas and West Virginia virtually. If this episode resonated with you, share it with a friend, and I'll see you next week at Sky Women's Health Podcast. Until next week, be well. Thanks for listening. This episode is sponsored by Sky Women's Health. If you love this episode, follow the show so you never miss one. Share it with the women in your life and help more people discover it. Let's make it binge-worthy.